What I'm about to tell you might shock you, but that innocent bulb of garlic sitting in your kitchen right now could be either your greatest health ally or your most dangerous enemy. The difference isn't in the garlic itself, but in how you're using it. In my 45 years as an internist, I've seen garlic send patients to the emergency room with liver damage, and I've also watched it transform lives by reversing decades of health problems. The scary part? Most people have no idea which category they fall into. Hello, my dear friends. I'm Dr. Richard Caldwell, and at 83 years old, I've spent nearly half a century helping patients navigate the complex world of health and wellness. I graduated from Harvard Medical School in 1965, completed my internal medicine residency at Mayo Clinic, and served as chief of internal medicine at Boston General Hospital for 30 years. I've treated over 15,000 patients, published more than 200 research papers, and even now I still see patients 4 days a week because I believe that real health wisdom comes from combining scientific knowledge with practical, everyday solutions. People often ask me, Dr. Caldwell, what keeps you so vibrant at your age? What's your secret to staying healthy? They expect me to mention some exotic supplement or expensive treatment. But the truth is, my health philosophy is built on understanding how to use the simple foods we encounter every day. And no food illustrates this principle better than garlic. You see, garlic isn't just good or bad for you. It's incredibly powerful, which means it can be incredibly beneficial when used correctly, or incredibly harmful when misused. Today, I want to share with you everything I've learned about garlic over 4 decades of medical practice, including some cases that still give me chills and others that fill me with hope. If you stay with me end of this video, you'll understand exactly how to harness garlic's healing power while avoiding its hidden dangers. And if you find this information valuable, please give this video a thumbs up and subscribe to the channel. I share evidence-based health insights every week, and I want to make sure you have access to information that could genuinely transform your well-being. Let me start with a story that changed my entire perspective on garlic. About 8 years ago, a 71-year-old woman named Patricia Henderson was rushed to our emergency department. She was jaundiced, exhausted, and confused. Her family was terrified because she had been perfectly healthy just months before. The blood tests revealed severe liver damage, and initially, we suspected hepatitis or some other serious liver disease. But as we dug deeper into Patricia's medical history and lifestyle, a disturbing pattern emerged. Patricia had read an article about garlic's health benefits, and she had taken it to heart in the most literal way possible. She had been eating 6 to 8 cloves of raw garlic every single day for over 6 months, believing that more was better. She would chop it up and swallow it like pills, thinking she was boosting her immune system and protecting her heart. What Patricia didn't realize was that she had been consuming garlic that was past its prime. Some of the bulbs in her pantry had soft spots, minor mold, and that slightly green tinge that indicates deterioration. She would simply cut off the obviously bad parts and use the rest, thinking she was being frugal and that cooking would kill any harmful bacteria. The truth was far more dangerous. Moldy garlic can produce aflatoxins, which are among the most potent carcinogens known to science. These toxins are heat-resistant, meaning that cooking doesn't destroy them. Over months of consumption, these toxins had accumulated in Patricia's liver, causing severe damage that could have been fatal if we hadn't caught it when we did. The most heartbreaking part of Patricia's story was that she had been trying to take care of her health. She had heard that garlic was good for cholesterol and heart health, which is true, but no one had told her about the proper way to consume it, or the warning signs to watch for. Her intentions were perfect, but her method was slowly poisoning her. Fortunately, Patricia's story has a happy ending. Once we identified the cause of her liver damage and she stopped consuming contaminated garlic, her liver began to heal. We put her on a liver support protocol, and over the next year, her liver function returned to nearly normal levels. But it took months of careful monitoring and treatment, and she always have to be more cautious about her liver health. Patricia's case taught me that I needed to educate my patients not just about what foods to eat, but exactly how to eat them safely. This led me to investigate garlic more thoroughly than I ever had before, and what I discovered was both alarming and exciting. On the alarming side, I began to see more patients with garlic-related problems. There was James Morrison, a 69-year-old retired accountant who loved pickled garlic. He would eat it with every meal, sometimes consuming 10 or 12 cloves a day because he enjoyed the sweet and sour taste. James was diabetic, but he thought the garlic would help his condition. What he didn't realize was that commercial pickled garlic is often loaded with sugar and high fructose corn syrup. Over several months, James's blood sugar control deteriorated dramatically. His hemoglobin, A1C, rose from 7.2 to 9.8, and he started experiencing symptoms of diabetic complications. When we analyzed his diet, the pickled garlic was contributing as much sugar as drinking 2 cans of soda every day. The garlic's beneficial compounds were being overwhelmed by the massive sugar load. Then there was Margaret Collins, a 74-year-old woman who developed severe stomach problems after following an internet recommendation to eat raw garlic on an empty stomach every morning. She had been doing this for months, believing it would cleanse her system and boost her immunity. Instead, she developed chronic gastritis, stomach pain, and eventually a bleeding ulcer that required hospitalization. Margaret's case highlighted another dangerous garlic myth, that raw garlic is always better than cooked garlic. While raw garlic does contain certain compounds that are reduced by cooking, it's also much more irritating to the digestive system, especially for older adults whose stomach lining may be more sensitive. But here's where the story gets exciting. As I was seeing these negative cases, I was also witnessing remarkable transformations in patients who were using garlic correctly. Let me tell you about some of these success stories, because they'll show you the incredible healing potential that garlic has when used properly. Dorothy Thompson, an 78-year-old former teacher, came to me with multiple health concerns. She had high blood pressure, high cholesterol, frequent infections, and chronic fatigue that made it difficult for her to enjoy her retirement. She had been on multiple medications, but she was frustrated with the side effects and wanted to try a more natural approach. I taught Dorothy how to prepare what I call therapeutic garlic, gently steamed garlic cloves mixed with raw honey. Every morning after breakfast and every evening after dinner, she would eat 2 cloves of this honey-garlic mixture. The preparation method was crucial. She would steam whole, fresh garlic cloves for 15 minutes until they were soft and sweet. Then store them in raw honey in a glass jar in the refrigerator. Within 6 weeks, Dorothy's transformation was remarkable. Her blood pressure dropped from 160/95 to 135/80. Her cholesterol levels improved significantly, with her LDL dropping by 35 points and her HDL increasing by 12 points. But what impressed me most was her energy level. She told me she felt like she had been given a new lease on life. She started traveling again, volunteered at her local library, and even took up ballroom dancing. The science behind Dorothy's improvement is fascinating. When garlic is gently cooked, the harsh compound allicin is converted into salilylcysteine, which is much gentler on the stomach, but actually more bioavailable and beneficial for cardiovascular health. The honey not only makes the garlic more palatable, but also provides antioxidants that work synergistically with the garlic compounds to support overall health. Another remarkable case was Robert Chen, a 65-year-old engineer who had been struggling with frequent respiratory infections and chronic sinusitis. Robert worked in a dusty industrial environment for most of his career, and his respiratory system had taken a beating. He was constantly on antibiotics and decongestants, which were affecting his digestive health and leaving him feeling run down. I introduced Robert to homemade garlic juice, but with very specific preparation and timing instructions. Instead of consuming raw garlic, which would have been too harsh for his already compromised digestive system, Robert learned to make a gentle garlic extract. He would finely mince 2 fresh garlic cloves, let them sit for 10 minutes to allow the beneficial compounds to develop, then mix them with half a cup of warm water and a teaspoon of honey. The key was that Robert consumed this mixture 30 minutes after his evening meal, never on an empty stomach. This timing allowed him to get the antimicrobial benefits of the garlic while protecting his digestive system. Within 3 months, Robert's respiratory infections became much less frequent. His sinusitis cleared up almost completely, and for the first time in years, he went through an entire winter without needing antibiotics. What made Robert's case particularly interesting was that his improvement extended beyond his respiratory system. His energy levels increased, his digestion improved, and even his cholesterol levels became healthier. This illustrates how garlic's benefits are systemic. When used correctly, it supports multiple body systems simultaneously. Let me tell you about Eleanor Martinez, A 72-year-old grandmother who came to me with concerning signs of cognitive decline. Her family had noticed that she was becoming forgetful, having trouble with word finding, and showing less interest in activities she used to enjoy. While these changes weren't severe enough for a dementia diagnosis, they were definitely progressing, and everyone was worried. Eleanor's case was particularly close to my heart, because cognitive decline is one of the most feared aspects of aging, and families often feel helpless watching their loved ones slip away mentally. I had been following research on garlic's neuroprotective effects, and I decided to incorporate therapeutic garlic into Eleanor's overall brain health protocol. I taught Eleanor how to prepare what I call brain food garlic, steamed garlic cloves, that she would eat with meals twice a day. The steaming process creates psilocystine, which research suggests can improve blood flow to the brain and protect neurons from damage. I also had her add this garlic to a Mediterranean-style diet rich in other brain-healthy foods. Over the next 8 months, Eleanor's cognitive function not only stabilized but actually improved. Her memory became sharper, she regained interest in reading and puzzles, and her family reported that she seemed more like her old self. While we can't prove that garlic alone was responsible for her improvement, it was a key component of a protocol that clearly worked. Eleanor's case represents something I see often in my practice. When we support the body with the right nutrients in the right way, it has an amazing capacity to heal and restore itself, even at advanced ages. Now, let me share with you the specific garlic consumption methods that you must avoid if you want to protect your health. These aren't just theoretical concerns. I've seen real patients suffer real consequences from these mistakes. The first and most dangerous mistake is consuming spoiled, moldy, or deteriorated garlic. I cannot stress this enough. Even a tiny amount of mold on garlic can produce aflatoxins, which are among the most potent liver toxins and carcinogens known to science. These toxins are completely invisible. You can't see, smell, or taste them, but they can cause irreversible liver damage and dramatically increase cancer risk. Many people think they can simply cut off the moldy parts and use the rest, but this is extremely dangerous. Once mold appears on any part of a garlic bulb, the entire bulb may be contaminated with aflatoxins. These toxins are heat stable, meaning that cooking, roasting, or frying won't destroy them. The only safe approach is to discard any garlic that shows any signs of deterioration. What should you look for? Soft spots, dark patches, green or black discoloration, any fuzzy growth, or an unusual smell. If a garlic clove feels soft when you press it, or if it has any discoloration beyond the normal white or pale yellow, throw it away immediately. Your health is worth far more than the few cents you might save by trying to salvage questionable garlic. The second dangerous consumption method is eating large amounts of sugar-laden pickled garlic. While pickled garlic can be part of a healthy diet when prepared properly, many commercial varieties are loaded with sugar, high fructose corn syrup, and excessive sodium. This combination completely undermines garlic's health benefits while creating new problems. The sugar interferes with allicin absorption and can cause dangerous blood sugar spikes, especially in diabetic or pre-diabetic individuals. The high sodium content can raise blood pressure and strain the cardiovascular system. I've seen patients whose blood sugar control deteriorated significantly after regularly consuming sweet pickled garlic, not realizing they were essentially eating candy disguised as a health food. If you enjoy pickled garlic, look for varieties with minimal added sugar, or better yet, learn to make your own using natural fermentation methods with just vinegar, water, and a small amount of natural sweetener like honey or maple syrup. The third problematic consumption method is garlic bread and other garlic-rich processed foods. While garlic bread might smell amazing and taste delicious, it combines garlic with refined flour, butter, and often sugar, a combination that can wreak havoc on your blood sugar, contribute to inflammation, and promote weight gain. The refined carbohydrates cause rapid blood sugar spikes. The excessive butter adds unnecessary saturated fat, and the combination can contribute to fatty liver disease over time. Moreover, the high heat used in baking can destroy many of garlic's beneficial compounds, while preserving the problematic ones. I had a patient, William Foster, a 67-year-old man who thought he was being healthy by eating garlic bread with every meal because it contained garlic. Over 2 years, he developed non-alcoholic fatty liver disease, gained 30 pounds, and his diabetes became much harder to control. When we eliminated the garlic bread and replaced it with properly prepared garlic, his health began to improve dramatically. The fourth dangerous practice is consuming excessive amounts of raw garlic, especially on an empty stomach. While raw, garlic does contain beneficial compounds. It's also highly irritating to the digestive system. Large amounts can cause stomach pain, heartburn, nausea, and in severe cases, stomach ulcers or dangerous changes in blood clotting. I've seen patients who thought they were boosting their immune systems by eating multiple raw cloves daily, only to develop serious digestive problems or dangerous interactions with blood-thinning medications. Raw garlic can potentiate the effects of warfarin and other anticoagulants, potentially leading to dangerous bleeding episodes. Now, let me share the safe and effective ways to consume garlic that will give you all the benefits without the risks. These methods are based on decades of clinical observation and scientific research. The first method I recommend is steamed garlic with honey. This preparation method transforms harsh, irritating raw garlic into a gentle, sweet, and incredibly therapeutic food. When you steam garlic cloves for 15 to 20 minutes, several important changes occur. The harsh allicin compound is converted into cysteine, which is much easier on your digestive system, but actually more beneficial for your cardiovascular health and brain function. Here's exactly how to prepare it. Take fresh, firm garlic cloves and remove the outer papery skin, but leave the cloves whole. Place them in a steamer basket over boiling water and steam for 15 to 20 minutes until they're soft and sweet. You can test doneness by gently pressing the clove. It should yield easily, but not be mushy. Once the garlic is steamed and cooled, place the cloves in a clean glass jar and cover them completely with raw, unprocessed honey. Store this in the refrigerator for at least 48 hours before consuming to allow the flavors to meld and the beneficial compounds to develop. Consume 1 to 2 cloves twice daily, preferably after meals. The honey not only makes the garlic delicious, but also provides additional antioxidants and helps your body absorb the garlic's beneficial compounds more effectively. This combination is particularly powerful for supporting immune function, cardiovascular health, and cognitive function. My patient, Dorothy Thompson, whom I mentioned earlier, used this method to transform her health completely. At 78, she had been dealing with high blood pressure, frequent colds, and low energy. After 6 months of consuming honey-steamed garlic daily, her blood pressure normalized, she stopped getting sick, and her energy levels increased dramatically. Her family said she seemed 10 years younger. The second method is therapeutic garlic juice, but prepared and consumed safely. Unlike the harsh raw garlic preparations that can damage your stomach, this method provides concentrated garlic benefits while protecting your digestive system. To prepare therapeutic garlic juice, take 2 to 3 fresh, firm garlic cloves and mince them finely. Let the minced garlic sit for 10 minutes. This is crucial because it allows the allicin precursors to convert into active allicin. Then mix the minced garlic with half a cup of warm water and a teaspoon of raw honey. The timing of consumption is critical. Never consume this mixture on an empty stomach. Always take it 30 to 60 minutes after a meal when your stomach has food to buffer the garlic's intensity. Start with a smaller amount, perhaps 1 clove, instead of 2 or 3, and gradually increase as your tolerance develops. This method was life-changing for my patient Robert Chun, the engineer I mentioned earlier. His chronic respiratory problems cleared up within 3 months of using this therapeutic garlic juice, and he experienced improved energy and better overall health. The third beneficial method is incorporating cooked garlic into your regular meals, but using specific preparation techniques that maximize its health benefits. When garlic is cooked properly, it becomes easier to digest while retaining most of its therapeutic compounds. The key is gentle cooking methods and proper timing. I recommend sautéing minced garlic in a small amount of olive oil over low heat for just 1 to 2 minutes, or adding whole cloves to soups and stews that simmer gently. High heat and long cooking times can destroy garlic's beneficial compounds, so gentleness is essential. My patient Michael Rodriguez, a 66-year-old chef, had been suffering from high cholesterol and frequent infections despite his active lifestyle. I worked with him to modify his cooking methods to maximize garlic's therapeutic potential. Instead of the high heat sautéing he was used to, he began using gentle cooking methods and adding garlic at the end of the cooking process. Within 4 months, Michael's cholesterol levels improved significantly, and he noticed that he was getting sick much less frequently. His blood tests showed improvements in markers of inflammation, and his energy levels increased noticeably. The beauty of this approach was that Michael didn't have to change what he ate, just how he prepared it. The fourth method is aged garlic supplementation, but only when you can't tolerate any other forms. Some people have such sensitive digestive systems that even properly prepared garlic causes discomfort. For these individuals, aged garlic extract supplements can provide benefits without the digestive irritation. However, I always prefer food-based approaches when possible because whole foods provide synergistic compounds that isolated supplements can't replicate. If you do choose to use garlic supplements, look for aged garlic extract rather than raw garlic powder, and always take them with food. Now, let me explain the fascinating science behind why these preparation methods work so much better than random garlic consumption. Understanding this will help you make informed decisions about how to include garlic in your health routine. Fresh garlic contains a compound called allicin, which is relatively inactive. When garlic is crushed, chopped, or chewed, an enzyme called allicin converts allicin into allicin, which is responsible for garlic's characteristic smell and many of its antimicrobial properties. However, allicin is unstable and quickly breaks down into other compounds, some beneficial and some potentially irritating. When garlic is gently cooked or steamed, allicin is converted into cysteine and other stable sulfur compounds that are actually more bioavailable and easier for your body to use. These compounds have powerful antioxidant effects, support cardiovascular health, and may help protect against certain types of cancer. The liver protective effects if properly prepared. Garlic are particularly important as we age. Cysteine helps support the liver's detoxification processes and may help protect liver cells from damage. This is especially relevant given that liver function naturally declines with age and is constantly challenged by environmental toxins and medications. Garlic single quotes S cardiovascular benefits are also remarkable. The sulfur compounds help relax blood vessels, reduce inflammation, prevent cholesterol oxidation, and may help prevent blood clots. Multiple studies have shown that regular garlic consumption can modestly reduce blood pressure and cholesterol levels, though the effects are gradual and require consistent consumption over months. For brain health, emerging research suggests that garlic's sulfur compounds may help protect against cognitive decline by improving blood flow to the brain, reducing inflammation, and protecting neurons from oxidative damage. While we can't claim that garlic prevents Alzheimer's disease, the research is promising enough that I include it in my recommendations for healthy brain aging. Storage is another crucial factor that most people overlook. Improper storage can not only reduce garlic's beneficial compounds, but can also create conditions for harmful mold growth and toxin production. Whole garlic bulbs should be stored in a cool, dry, well-ventilated place. Don't store them in plastic bags or airtight containers, as this can trap moisture and promote mold growth. A mesh bag or open basket in a pantry or cupboard away from heat sources is ideal. Properly stored whole garlic can last for several months. Once you break apart a garlic bulb, the individual cloves should be used within a week or two. Peeled garlic cloves are much more perishable and should be stored in the refrigerator and used within a few days. If you notice any soft spots, discoloration, or unusual odors, discard the garlic immediately. For optimal freshness and safety, I recommend buying garlic from reputable sources and choosing firm, plump bulbs with tight, papery skin. Avoid garlic that feels soft, has visible mold, or has started to sprout green shoots. Now, let me address some important safety considerations and contraindications. While garlic can be incredibly beneficial, it's not appropriate for everyone in all circumstances. If you're taking blood-thinning medications like warfarin, clopidogrel, or aspirin, you need to be cautious about garlic consumption because it can enhance these medications' effects and potentially increase bleeding risk. This doesn't mean you can't consume garlic, but you should discuss it with your doctor and possibly have your blood clotting monitored more frequently. People scheduled for surgery should stop consuming therapeutic amounts of garlic at least 2 weeks before their procedure because of its blood-thinning effects. Again, small amounts used in cooking are generally fine, but therapeutic doses should be avoided. If you have gastroesophageal reflux disease, stomach ulcers, or other digestive conditions, raw garlic may worsen your symptoms. The cooked preparations I've described are usually much better tolerated, But you should start with small amounts and pay attention to your body's response. People with diabetes need to be particularly careful about honey garlic preparations because of the sugar content in honey. While the amounts I recommend are small, they can still affect blood sugar levels. Monitor your glucose levels carefully and adjust your medication if necessary under medical supervision. Some people are allergic to garlic, though this is relatively rare. Symptoms can include skin rashes, breathing difficulties, or digestive upset. If you experience any unusual symptoms after consuming garlic, discontinue use and consult with a healthcare provider. Pregnant and breastfeeding women should limit garlic to normal culinary amounts and avoid therapeutic doses, as high amounts may affect breast milk flavor or potentially stimulate uterine contractions. Let me share one more patient story that illustrates the importance of individualized approaches to garlic consumption. Helen Rodriguez, an 81-year-old woman with a history of stomach problems, wanted to use garlic for its health benefits, but couldn't tolerate any raw preparations. We worked together to find a method that worked for her sensitive system. Helen began adding just 1 steamed garlic clove to her vegetable soup each day. This tiny amount, consumed with other foods in a gentle preparation, provided enough therapeutic benefit to support her immune system without causing digestive distress. The course of a year, Helen's overall health improved noticeably. She had fewer infections, her energy increased, and her family reported that she seemed more vital and engaged. This case taught me that even small amounts of properly prepared garlic can provide significant benefits when used consistently and appropriately. The lesson from all of these patient stories is that garlic's effects depend entirely on how you use it. The same food that can damage your liver when contaminated or consumed incorrectly can become a powerful healing ally when prepared and used properly. As I reflect on my 45 years of medical practice, I'm continually amazed by the power of simple, everyday foods to either support or undermine our health. Garlic is perhaps the perfect example of this principle. It's not exotic or expensive, it's available everywhere, and when used correctly, it can provide benefits that rival many medications. But here's what I want you to understand. Health isn't about finding magic bullets or perfect superfoods. It's about developing wisdom in how you nourish your body every day. It's about understanding that the same food can be medicine or poison depending on its quality, preparation, and how you consume it. The patients whose lives were transformed by proper garlic use didn't experience miracles overnight. They made small, consistent changes and stuck with them over time. Dorothy didn't reverse her high blood pressure in a week. It took months of daily honey garlic consumption combined with other healthy lifestyle choices. Robert's respiratory health didn't improve overnight. It required consistent use of properly prepared garlic juice for several months. This is the reality of natural healing. It requires patience, consistency, and wisdom, but the results can be profound and lasting. Unlike medications that often work quickly but come with side effects, natural approaches like proper garlic consumption work slowly, but tend to improve overall health rather than just addressing isolated symptoms. As you leave here today, I want you to go to your kitchen and examine your garlic. Look for any signs of deterioration and discard anything questionable without hesitation. Check how you've been storing your garlic and make any necessary adjustments to keep it fresh and safe. Importantly, think about how you've been consuming garlic. Have you been eating it raw on an empty stomach? Have you been consuming large amounts of sweet pickled garlic? Have you been ignoring signs of spoilage? If so, now you know better, and you can make healthier choices going forward. Consider trying one of the therapeutic preparation methods I've described. Start slowly, pay attention to your body's response, and be consistent. If you have any underlying health conditions or take medications, discuss your plans with your healthcare provider. First, remember, the goal isn't to consume as much garlic as possible. It's to consume it in a way that supports your health without causing harm. Sometimes less is more, especially when it's prepared and consumed correctly. The wisdom I want to leave you with today is this: respect the power of the foods you eat. Garlic, like many natural substances, demands respect. When you approach it with knowledge and wisdom, it can be a powerful ally in your journey toward better health. When you approach it carelessly, it can cause real harm. Your health is built from thousands of small daily choices. The choice to discard questionable garlic instead of risking your liver health. The choice to prepare garlic properly instead of taking shortcuts. The choice to consume it mindfully instead of carelessly. These small choices, accumulated over time, create the foundation of lifelong wellness. If this video has opened your eyes to new ways of thinking about garlic and food safety, please give it a thumbs up and subscribe to the channel. Share it with your family and friends, because this information could literally save someone's life. I read every comment, so please share your own experiences or questions about garlic consumption. In my next video, I'll be discussing the powerful food combinations that can amplify garlic's benefits while protecting against its potential risks. You'll learn how to create synergistic combinations that support every system in your body using simple, affordable ingredients you probably already have in your kitchen. Thank you for trusting me with your time and attention today. Take care of yourselves, be wise in your food choices, and remember, good health is built one thoughtful decision at a time. Until next time, this is Dr. Richard Caldwell wishing you vibrant health and the wisdom to nurture it properly.